I think that the frustration and the feeling that you've used up all the other options is a very powerful motivating tool to try something new and somewhat more threatening, at least in the sense that it involves an emotional issue. What I'm hoping is that as more people learn about this diagnosis, and as this becomes more acceptable in the medical community and published in research articles and all the things we're trying to do, that we won't have to go to the point that people spend $50,000 and 4 years of not being off work and 8 years of pain before they'll take a step forward. But it's probably going to take more doctors being aware of this and more awareness in the media level and on the general community level for people to think about this, if not at the very first, then at least the second or third time, not at the 15th or 18th or 32nd level of treatment failure. As you pointed out, this is cost effective, it's non-invasive, doesn't involve medications, and for all of those reasons, I'm hoping that over the next few years that different entities, perhaps insurance companies, perhaps HMOs, perhaps universities, will begin to understand and accept this and begin to, maybe push this more into the mainstream.
I wish I had known about this 4 years ago. And it would have saved me 4 years of being unable to work and lots of years of pain. And what you said is that it wasn't too far down the line in your injury that you found Sarno, and he said to you, well, it might be psychosomatic. What do you think about that? I think when you have 3 orthopedic surgeons and 3 neurologists and 6 chiropractors and 6 acupuncturists, and you have this huge load of doctors saying to you, it's physical. What's wrong with you is physical. Then that's what you think. You trust them. They're the experts. Yeah. No doctor said to me, this might be due to stress. No, had the second or third doctor said to me, this might be due to stress, let's take another approach, then I might have been receptive to that. So I think a lot of it is that we have the whole weight of the mindset of Western medicine kind of pulling against this type of treatment.
I grew up in a family, both my parents have chronic back pain and have a belief that it's all physiological. So there's a lot of resistance from their part. I mean, I've tried to get them to see that the mind-body connection, but I was raised in that way. So I think, too, it has to do with how you're, what's going on in your family of origin, how they look at pain, and how they, for me, somaticizing was the way that I learned to cope, as well as my parents. And that's what I learned. It makes perfect sense.
It's almost a need for a cultural shift as well as a medical shift for this to sort of disseminate down to the family level. Even the doctors who acknowledge that stress causes different physical symptoms aren't really familiar with the idea that there's a methodology of teaching people how to connect their emotional feelings or their stress reactions, et cetera, to get rid of those physical symptoms. They might give lip service to the idea of, oh yeah, stress can cause tension headaches, or stress can cause jaw pain, TMJ, or irritable bowel, or whatever. So one of the things we're talking about in this video is a systematic approach that we're hearing from people of getting a different diagnosis, of starting to do a journaling, sometimes of seeing a psychologist, et cetera, a series of steps that can be taken to get over it. And I think that's one of the things that we're hoping to do is make this a little more systematic or programmatic, because then it's possible that doctors could find it an easier thing to implement in their office.
Once you let the fear take over, it paralyzes you. And in my case, what happened the very first time I had a problem, my kids, who at that time were, I think, like 5 and 3, had to come to my rescue, so to speak, in the middle of the night, like at around midnight. And because of that fear of this happening again, the back spasm and just totally paralyzing me, I know why when I allow the TMS to take over, I know where it's coming from, because it's that fear that might happen again. So if I can tell you anything is, to overcome that fear, of course it's easier said than done, but it's the fear that paralyzes you, because you don't want to feel that again. We don't want to be in pain. Exactly. We definitely don't want to be in pain. But it's the fear that puts a stranglehold on you. And actually, if you think about the diagnosis, and then there it goes, restricting the blood flow. And the more fear you have, the more blood flow is restricted. And then all of a sudden you say, and not, well, maybe, you know what, maybe Dr. Schechter wasn't right. Maybe that other guy that said that, you know, that L5 and L, you know, right, you know, so it just kind of starts building into it, and you have to learn how to get pushed through it and get over it and accept that it's not that. And again, it's easier said than done, but it is the fear, I feel, that just paralyzes you.
In order to get where I am today, I had to overcome that fear, and now it's, I mean, there's, when we first saw each other, I was a fearful person. I mean, the way I dealt with my body, I didn't want you to touch my elbow. I thought it would send tingling sensations down my arm, because that's what would happen if you touched me here. And it's been a gradual sort of up and down. With there are days when I don't care, and then other days when I'm very fearful and trying to explore what am I scared of? Why should I be afraid?
I've found that TMS can be very cunning, baffling, and powerful in the sense that it is patient and deceiving to the point where everything is going okay, and then I fall into fear, and I don't realize I fell into fear until a week later. I don't realize that I chose to sit a different way one day, and then all of a sudden I look back, oh yeah, it started right then, right when I gave it its power. You know what I mean? So the minute I give it its power, it's like, we're in, you know what I mean? And it just goes.
I mean, first to notice that in this range of 7 people, physically everyone had similar but very different symptoms, and that as people, you know, we're all come from different backgrounds, we have different careers, but it's not like we all then, once we acknowledged TMS, we had to change into like a certain type of person, because we're still who we are. And what you had mentioned is it's more about accepting it, recognizing it, admitting it, and only then does the change start. And that I think I sort of misinterpreted Sarno when I first read it, was that if you're this type of personality, which is prone to this, then suddenly you have to now become the type of laid-back, mellow type of person. I mean, again, to go back to what my parents were saying, oh, you work too hard, just gotta chill out, take a vacation. And that's not really what it is about. It's more about what you had just mentioned about acceptance and understanding. And I think, I mean, I'm still dealing with that because obviously I haven't fully come to terms with that. I'm saying that intellectually. I don't know if I've totally internalized that, but it's borne out by the fact that if you look at all of us, we're all very different symptoms, but we've all dealt with it and haven't, you know, we're all not like, you know, sitting back on the beach with, you know, bathing in the sun, chilling out. That's not who we are.
Yeah, and I think that the pain and the problem has to come out in your lifetime, sooner or later, even if it's on your deathbed when you're 80. You know, it's part of the life process to get these things, to resolve these issues. So when one has a real physical problem that gives you a weak point, you might have a real weak back, or you might have a toothache, or whatever it is, or some tendonitis tendencies. I think that gives the emotions an opening to start this process. So in some ways, I mean, I wish none of this had happened, but I do acknowledge that this stuff had to be addressed sooner or later. So the disaster that occurred to me opened the door for exercising all these emotional issues.
Cory, you mentioned there was a question that I asked you in the office that really touched home for you. What was that question?
Well, yeah, the question was what's going on in your life? And I've been in therapy on and off for years before I ever met you, so I'm very familiar with that question. And I'd seen a multitude of doctors, I don't know how many over the course of my life, and I don't know if I've ever been asked that question by my doctor, and I went to see you as a doctor, not as a therapist. And I just, my shoulders dropped, and I got emotional, I think, within 10 seconds. It was like,
I want to thank this group of individuals very much for making the trip today. Ty, Carrie Beth, Cory, Susan, Anastasia, Justin, Steve. You know, it's a diverse group of individuals, people in their 20s, 30s, 40s, 50s, some people who live in Los Angeles, some people who live in suburbs, some people who live in different cities, people with a variety of different occupations, a variety of different pain syndromes, who cared enough today to come down, to be interviewed on video, to help us to understand how successful patients get over their pain, and to help us prepare a video that will be utilized for other people going through this program, hopefully in the near future. And I want to thank you all very much for coming. I do appreciate it. And I'm also thanking you for the people who will hear this in the future and get a great deal out of it. Thanks very much. I now have the honor and the privilege of having with me three of the eminent TMS thinkers in the field. I have Donald Dubin, a psychotherapist. I have Dr. Art Smith, a philosopher and practitioner of mind-body medicine. And I have Dr. Arlen Ring, a psychotherapist. Welcome.
I think there was a lot there that interested me as a psychotherapist in dealing with the issues, and there was some people were dealing with the issues in an intellectual way, and had done some quick recovery based upon their intellectual way, but it shows that there's a vast range of how people deal with it interpersonally. And some of them were more introspective and wanted to go deeper into the psychological aspects of it, and others were very successful without going into the deeper. And this is just a general how people handle things. So I think it was a fantastic thing just to see how people approach it and want to approach it, and each person is going to take it in their own individual way.
Dr. Smith, you're a philosopher, and you've been around this field for a while. In fact, you're involved with the research foundation of which we've set up in terms of TMS research. Do you have any kind of one-sentence summation of what you heard today that you think might be helpful for people to hear in the course of the video?
Don't be afraid of what your emotions are. As one psychologist once said to me, what you feel ain't no big deal. Look and be honest with yourself. To thine own self be true, as Socrates said. And in so doing that, that's where the relief of the pain is going to come from.
It's good to tie a philosopher into the whole thing, since you're a philosopher. Now we're moving on to Arlen Ring, no newcomer to psychology, but a relatively newcomer to participating in TMS treatment with patients of mine over the last year or two. Anything that you heard today that would be worth discussing?
What is the difference between those that read the book, do the workbook, and get better at that point, and those that need more help? Because sometimes I'm in the position of being the more help. And I've come to believe that for some people, the anger and also fear, which several people emphasized today, that fear was a factor for them, not just anger, and I believe that's true too, that the fear and the anger in some way is serving some function for them. That and it seems to me that those that need the extra help, perhaps of spending some time with a therapist, are those for whom the fear and the action are part of a whole system of thinking, a whole way of believing. The lady today that said that her pain coincided with the time of the relationship. So she had a stake in not knowing about that, because perhaps she would have had to do something about the relationship before she was prepared to do so. So I think that it's those for whom the fear and the anger really serve a function that I think find themselves unable to let go of the pain very easily because they're not very willing to let go of the fear and anger.
Those are very interesting comments. You know, I think the TMS exists pretty much in everybody because it has some type of adaptive function. It's not purely malicious, as a couple of the patients made it seem like today, but that function, in a sense, helps a person to avoid living, at least living fully. And so with regard to relationships and other issues, there may be more of a need to mask emotions and mask feelings and deal with it in this sort of indirect way. And I think that's what often pulls people back to the doubt that they have, is that they're not sure if they can live without this somewhat adaptive system of pain that has replaced the feeling of emotions. And when they get to the point that they're comfortable with that, either with psychotherapy or on their own, then the pain goes away.
You know, one gentleman made a very good point. He said the pain becomes your friend, in a way. I thought that was very telling. And I think our job is to help the person remember that they're a much better friend to themselves than the pain is to them.
People do structure their lives around the pain, around the treatments that they get, and around the therapies, physical type of therapies that they get. And in a sense, what we're offering them is a complete change in that type of life. And I think that psychotherapy plays a key role in helping people to adapt to that change, as well as making some of the emotional issues that are repressed or unaware of come to the surface. Well, thank you all very much for sitting with us for a couple of minutes. Any final comments from any of you before we break?
Yeah, one person also referred to blame, made the point of view that you're not to blame. And I'll tie that together with what another person said about the whole system. Your family, the medical profession are all leading you to believe it's physical. I think that some people maybe need a little extra help in making that leap from, if it's not physical, am I to blame, and distinguishing between blame and responsibility. That taking responsibility gives them power, the power to leave this behind, and that it's not the same thing as being to blame.
Well, one of the other things that I heard among the people, a few of them started to talk about acceptance of the psychological part of themselves that they'd been repressing and trying to get rid of. And the acceptance and surrender, I think, is a key part to really understanding the source of the pain and how the pain comes out, and what the psychological traumas that people have received in their early life, and how it created their reactions to the world. And they've always been trying to subvert those psychological reactions, and now as they begin to know them and accept them, they can really deal with the source of the pain.
This is Dr. David Schechter. Today we've interviewed 7 panelists on their successful treatment of tension myositis syndrome. I hope this has been helpful to you as you seek to get rid of your pain and move on with your life. Thanks very much.